Did you know your body may be showing signs of heart disease right now? And most people completely miss them? Not just chest pain, not just heart attacks. Your ears, eyes, nails, skin, and even your ankles can quietly reveal that something is wrong with your heart. And the scary part is, heart disease often develops silently for years before a major event happens. That's why today, we're going through some of the most important warning signs you can check on yourself at home. And trust me, a few of these signs might surprise you. Let's start with your ears. There's something called an earlobe crease, a deep diagonal line that runs across the earlobe. Doctors have linked this sign to aging blood vessels and increased heart disease risk. Why? Because the tiny blood vessels in your earlobes can reflect what's happening inside the arteries of your heart. Now move to your eyes. Do you notice yellow patches near the corners of your eyelids? These are cholesterol deposits called xanthelasma. They happen when cholesterol starts building up underneath the skin. And if it's collecting there, it may also be collecting inside your arteries. Another eye sign is a gray or white ring around the iris. In older adults, it's common, but if it appears early, it can sometimes signal high cholesterol and increased cardiovascular risk. Next, look at your skin. Some people develop a purple or net-like pattern on their legs that doesn't disappear easily. That can sometimes point to poor circulation or blocked blood vessels. Now let's talk about swelling. Do your ankles swell by the end of the day? Do your socks leave deep marks? Try pressing your finger into your shin for 10 seconds. If a dent stays behind, that's called pitting edema. This can happen when the heart struggles to pump blood efficiently, causing fluid to back up into the legs and feet. And if fluid buildup gets worse, it can even reach the lungs. That's why many people with heart problems notice shortness of breath when lying flat. Some even start sleeping with multiple pillows or in a recliner because breathing feels easier sitting upright. Now check your fingernails. Do they look enlarged or curved downward? This is called clubbing, and can sometimes happen when oxygen levels stay low for long periods because of heart or lung disease. Also look for tiny reddish-brown streaks under the nails. These are called splinter hemorrhages. Sometimes they're harmless, but when they appear on multiple nails along with fever or fatigue, they can point to infection inside the heart valves. And here's one of the most important things you can do right now. Check your pulse. Place 2 fingers on your wrist. Does your heartbeat feel steady and predictable, or irregular and random? An irregular rhythm may be atrial fibrillation, a very common heart condition that increases the risk of stroke because blood clots can form inside the heart. Many people don't even know they have it until something serious happens. Finally, never ignore these symptoms. Unusual fatigue, dizziness, chest pressure, reduced stamina, or feeling exhausted doing simple daily tasks. A lot of people blame aging, but sometimes your heart is struggling to deliver enough oxygen-rich blood to the body, and your body tries to warn you long before a major emergency happens. That's the important message here. Your body whispers before it screams. So take a few minutes tonight and actually look for these signs. Check your eyes, your ankles, your nails. Feel your pulse. Because catching heart disease early can literally save your life.